If you talk about the GI tract, as I discussed before, the GI tract has got two main components. One we call as a luminal GI. Luminal GI means the food tract from esophagus to the small intestine, large intestine, anal canal. This is the luminal. And there's something called as a solid organs, like I told about the liver, the pancreas, the biliary system, the spleen, and other organs. So when we talk about this liver, pancreas, and biliary, normally they are the secretory organs. What they secrete the juices which helps for the digestion. So they are connected to the GI tract. Like liver, which is one of the biggest organ of the body and which carries more than 500 types of function. The liver produces the very important substance called bile, which is a digestive juice. And from the liver, a tube connect to the intestine. These digestive juices are secreted into the intestine and they help for digestion. Similarly, a pancreas is another organ. Commonly, we know pancreas which secretes the insulin and which controls our sugar, but it also secretes certain enzymes which help for digestion, which also connected to the intestine. So this liver, biliary system, and the pancreas are also called as accessory organs of our gastrointestinal tract, which secretes something which helps for the digestion. Now, HPB surgery, that is hepato pancreato biliary surgery, is the surgeons who are trained in the liver, pancreas, and biliary surgery. This is the latest and the most important subspecialty of a super specialty. And in India, there are very few qualified HPB surgeons who are practicing HPB cancer surgeries. Okay, if you talk about the cancers of these organs, primarily the liver being the biggest organ, we do get the liver cancers, quite a good number of liver cancers. And liver is a fantastic organ. Liver is the only organ in the body which has got a capacity to regrow. Understand?
Right.
So for normally for us, we need around 25% or 30% of a liver, which is sufficient for our functioning. So up to 70% of a liver we can cut out if there's a cancer or if there's some problem. Understand? And 25-30% liver is definitely sufficient for us if we have a good blood supply to the liver and a good drainage to the liver. And after the surgery, let's say if we remove 60-70% of a liver, the remaining 20-30% of a liver will be regrowing to 90%. Liver is a fantastic organ which has got capacity to regrow. And that exact reason it is possible to do a liver transplant. In a live transplant, where a patient's family member donate a part of a liver to a family member who has got a liver problem, liver failure, liver cirrhosis, or maybe a cancer, So liver transplant is possible only because the liver regrows and we need only 20-25% of a liver. So when we transplant this donated liver into the patient's body, that liver also regrows to 90%, as well as the patient's liver who has donated also regrows. So liver is the unique organ with the capacity to regrow. Now, if the liver cancers normally happens in the background of the disease called cirrhosis. Cirrhosis means there are damage in the liver. The liver is like a spongy organ, which because of a recurrent infection like a viruses, or there are some other multiple pathologies where liver becomes hard structurally, as well as liver functions deteriorate to an extent that they go in an end stage. When we talk about the end stage, that means the liver functions are so bad that they cannot perform our day-to-day activities, the body functions. And this particular group of patients, they require a liver transplant. Now, the cancers, 90% of liver cancers happen in patient in a background of liver cirrhosis. The liver is bad, liver is hard. In that background, there are chances that they produce hepatocellular carcinoma, that is liver cancer. Now, if you see, only 10% of a patient who would have liver cancer in a normal liver, there is no cirrhosis. So, of course, this particular 10% of patients are rare, and if they come, they would need definitely a surgery. That can be either right liver resection, left liver resection, or any kind of major supramajor liver resection without any need of transplant. But if there's a liver tumor in a background of a cirrhosis, then there are two problems. One is a cancer, and second is a cirrhosis. Cirrhosis, as I told, that liver is unable to function is a daily activities. So in this particular group of patients, selected patient, not all patient, the selected patient, liver transplant is one surgery which can cure both, which can also cure cirrhosis because the primary liver is not functioning, and which has also got a tumor, can be also cured by liver transplant, because in the liver transplant, we remove that diseased liver which has got a tumor as well as cirrhosis, and we put in a new liver, either from a cadaver or from a donated from the family members. This is about the liver cancer. Liver cancer should be performed in definitely a HPB unit where all the facilities are available. The most important thing in liver cancer surgery is the operation theater and post-operative ICU, which should be well equipped. We require a lot of gadgets, monitors. So definitely these surgeries are not possible at smaller centers. We have to perform in a big tertiary care unit. Now coming to the biliary cancers. Biliary cancers are normally very close to liver cancers, because liver has inside the liver, there are tuft of biliary trees. That means these bile ducts which are inside the liver, like blood vessels are going into the liver. There are the bile ducts which are inside the liver, and all these bile ducts take the bile from the liver, and they come to the gallbladder, and from gallbladder they come to the intestine. So if you see gallbladder cancer or biliary type of cancer which are coming close to the liver, they would need some kind of a liver resections. So the biliary system, which is connecting liver to the intestine to the pancreas, so they are all are related to each other. So the biliary cancers which are close to the liver would need some kind of a liver resection for their treatment, and the biliary cancers which are at the lower end close to the pancreas would need a pancreatic resections along with the bile duct. So this is the intermediate system which connects liver to the pancreas to the intestine. Okay.
Right, doctor. Right.
Now, third is the pancreatic cancer. Now, pancreatic cancers are also very common. Commonly, the head of the pancreas cancers are very common. And again, these cancers are normally diagnosed in later stages because of the patient don't get symptom. The most common symptom of the pancreatic cancer would be a jaundice, a rapidly progressing, painless jaundice. It is a very, very important symptoms. And as soon as the patient gets the jaundice, we should evaluate for this kind of diseases. Along with that, they do have a loss of appetite, loss of weight, itching, black color stool, multiple symptoms they produce. And head pancreatic cancers, generally, if they are operable, they would need something called as Whipple surgery, which is a big surgery where we remove head of the pancreas as well as few other organs like the biliary tree, gallbladder, a part of a small intestine, and a part of a stomach. After this surgery, we do many reconstructions to connect the stomach, connect the biliary tree, as well as connect the intestine to each other. So it's kind of a supra-major surgery. But at HPB unit, we commonly perform this kind of pancreatic, biliary, and liver surgeries.